Hi, I'm Lindsay Williams, and I constructed a model of the oral cavity. The materials that I used for this model are a conglomeration of craft materials. There's felt, yarn, embroidery floss, plastic wrap, ribbon, glue, pins, and the cardboard tube from the inside of a paper roll. So, to get us oriented with this sagittal view of the oral cavity, here is the mandible. Here is the hard palate, the soft palate, the tongue, the hyoid bone, and the styloid process of the temporal bone. These structures serve as points of attachment for many of the muscles of the oral cavity model. The extrinsic muscles of the tongue, there are 4 of them. You might notice that we have the geniohyoid and the mylohyoid, which are not the extrinsic muscles of the tongue. But just deep to those is the first of our muscles. This is the genioglossus, which originates on the mandible and inserts on the inferior aspect of the tongue. The genioglossus helps us protrude the tongue and also depresses the middle part of the tongue. Here, originating from the hyoid and inserting on the lateral aspect of the tongue, is the hyoglossus. The hyoglossus is the muscle that depresses the tongue. Superficial, and also part of it is inserting here. Some muscle fibers insert here, but others insert on the lateral aspect of the tongue, is the styloglossus. It gets its name from the styloid process of the temporal bone, its origin, and its insertion on the tongue. The styloglossus is the muscle that retracts the tongue and also elevates the tongue. Wow, not that much though. These 3 muscles of the tongue are innervated by cranial nerve 12, the hypoglossal nerve. The exception to that innervation is our last extrinsic muscle of the tongue, the palatal-glossus, which is innervated by the vagus nerve, cranial nerve 10. The palatal-glossus comes from the soft palate and inserts on the posterolateral surface of the tongue. It's responsible for elevating this posterior aspect of the tongue and also depresses the soft palate. Connecting the oral cavity to the pharynx here are the palatopharyngeus muscle and the glossopharyngeus muscle. The glossopharyngeus muscle is an extension of the superior pharyngeal constrictor muscle, which we have here. And connected to that and then coursing inferiorly is the middle pharyngeal constrictor muscle. And these muscles help form the lateral and posterior walls of the pharynx. Our last muscle that we have here is around the border of the middle pharyngeal constrictor muscle is the stylopharyngeus muscle, which originates on the styloid process and inserts on the middle pharyngeal constrictor muscle. Thanks, and good luck studying.